Welcome to GutTalk TV, a YouTube channel focused on closing the communication and knowledge gaps in gut health.
Please see a disclaimer and press the subscribe button below.
Hello everyone, I'm Dr. Jakob.
And I'm Dr. Yoon. We are gastroenterologists from Australia. Today we are going to talk about colonoscopy.
A colonoscopy is a short procedure to examine the lining of the lower part of your digestive tract. Your gastroenterologist will perform the test. Generally, an anesthetist will sedate you and ensure your comfort during the procedure. Under sedation, a thin flexible camera tube will be passed into the rectum and gently moved along the colon, using gas to inflate it so we can see adequately the insides of the colon. A magnified image of the colon's inner surface is projected on a TV screen. The test takes about 20 minutes in total, but you should plan for 2 to 4 hours of waiting, preparation, and recovery after sedation, so bring along a good book.
Before your procedure, you will have an opportunity to ask questions, particularly about the benefits and risks of your colonoscopy, and have these answered in a way that you understand. Colonoscopy is very safe. After bowel cleansing laxative, nausea and bloating is common and rarely lasts long. Unusual colon anatomy or poor bowel cleansing sometimes make high-quality colonoscopy impossible. In this case, your doctor may request a repeat colonoscopy on another day or another test, or they may feel that limited examination is adequate. To maximize your chance of a good bowel preparation, follow the bowel cleansing instruction carefully. Even with best techniques, polyps and tumors can be hidden from views and missed. The bowel wall may be unusually fragile and puncture or bleeding. Bleeding after polyp removal is usually minor and stops on its own. Complications needing urgent surgery are rare and happens less than 1 in 1,000 cases. Other uncommon problems include sedative or bowel preparation reaction, infection, or worsening of existing heart or lung disease. Occasionally you may wake with a sore jaw after an anesthetist has pushed some firmly here to keep your breathing regular and you safe during the test. This tenderness usually settles after a few days. Although complications are uncommon, it is important to recognize them early. Contact us or present to hospital if you notice severe abdominal pain, dizziness, fever, chills, and rectal bleeding, or severe shortness of breath.
It is important to arrange to have a carer for you when you leave the hospital. Every patient who has a procedure performed under sedation or general anesthetic and is leaving hospital on the same day as their procedure needs to be taken home by a carer who is over the age of 18. This person will be responsible for your well-being and recovery for up to 12 to 24 hours, depending on the type of anesthetic that you have received. You cannot drive, drink alcohol, sign legal documents, or operate machinery for the first 24 hours after your procedure. This is because the sedative medication you received may affect your concentration or coordination. In preparing for your colonoscopy, it is also important that you arrange your normal activities to take time off in preparation of the procedure and on the day of procedure. A medical certificate can be provided on discharge for yourself and the person responsible for picking you up from hospital and caring for you at home.
Most medication can be taken up to and on the day of the test. Be sure to tell your doctors if you have any drug reactions or allergies. Some medication must be stopped prior to your procedure. This instruction will be given by your doctor and listed on your bowel preparation instruction. Ensure you check and follow these instructions. Patients with diabetes on insulin or with non-insulin dependent diabetes or on oral medications may benefit from some planning prior to the procedure regarding prolonged fasting and medication doses. If you are on anticoagulation such as Eliquis, Apixaban, or Xarelto or warfarin, please contact the room for consultation at least 7 days prior to your colonoscopy. You will need to discontinue any iron supplements or fish oil 7 days prior to the procedure. Other medications are usually continued unless your family doctor tells you not to do so. On the day of your procedure, you can take your regular medication with sips of water.
For the procedure, deep sedation is usually given. You may be vaguely aware of what is going on in the room, but generally you have little recollection of the procedure and won't feel anything. The doctor and medical staff will monitor your breathing, your pulse, and blood pressure during the procedure and will make you comfortable. A colonoscopy usually takes between 20 and 45 minutes. Once you are sedated and lying on your left side, the doctor passes the instrument through the anus and into the colon. A small camera at the end of the scope transmits a video image to a monitor, allowing the doctor to examine the intestinal lining in detail. Once the scope has reached the point where the small intestine joins the colon, it is then withdrawn carefully and the lining of the colon is examined again for any pathology. A polyp is a small tissue growth on the bowel wall. They are common and are usually harmless, but a small proportion of them may develop into cancer over the long term. Removing polyps is an effective way of preventing cancer. Small tissue samples or biopsies of the colon or terminal ileum may also be taken for examination under the microscope for signs of any disease. Following the procedure, you will remain in the recovery area for an hour or two until the sedation wears off completely. You will usually be given something to eat and drink once you are fully awake. You may feel a little bloated due to the gas that is used to inflate the colon to allow adequate inspection of the lining. It generally passes within an hour or two. Rarely, you may pass a small amount of blood. This is often due to the samples that have been taken or the polyps that have been removed and should settle on its own. Because of the sedation given during the procedure, it is very important that you do not drive a car, travel on public transport alone, operate machinery, sign legal documents, or drink alcohol on the day of your procedure. It is strongly advised that a friend or relative takes you home and stays with you. Full recovery is expected by the next day. It is important to read your discharge instructions carefully.
I hope you found this video helpful, but if you have any questions, please leave in the comment section below. Thank you very much.